Hello, and welcome to my capstone presentation. My name is Chikita Nigam, and my project is titled Nature's Wealth, Quantifying Benefits of Nature Exposure and Promoting Equitable Access Through Policy. For my capstone, I worked with Nature and Health, which is an Earth Lab organization, with Alicia Keefe as my site supervisor and Dr. Michelle Johnson Jennings as my faculty advisor. And today, I am thrilled to share my project with you. So, imagine if the solution to some of our most pressing health and economic challenges was right outside our door. Nature isn't just a backdrop to our lives, it's a powerful resource with the potential to improve health, save money, and strengthen communities. Yet, rapid urbanization has widened the gap between people and nature, leading to increasing health, economic, and societal challenges, all of which are compounded by rising monetary costs associated with them. Despite the well-documented benefits of nature exposure, inequitable access and limited policy support prevent many communities, especially marginalized ones, from experiencing these advantages. Moreover, while there is a wealth of qualitative evidence on the benefits of nature exposure, very few studies try to quantify its monetary benefits. Determining the value of the benefits from nature exposure can underscore its economic impact, while identifying targeted policy interventions can ensure equitable access for all communities. So, based on this, the purpose of my capstone project was to address two key questions. First, what are the economic benefits and cost savings associated with access and exposure to nature? And second, what policy interventions can effectively promote equitable access to nature? So, during my internship at Nature and Health, I worked on creating a comprehensive literature review on the quantifiable healthcare savings associated with nature exposure. This process included a rigorous search for studies that examined health benefits and associated financial cost savings of nature exposure, which helped address my first research question. To answer my second question, I examined literature that focused on identifying policy solutions that promote equitable nature access. I also conducted interviews with public health, environmental health, and public policy experts to get more comprehensive and well-rounded insights about policy interventions that could specifically cater to the needs of BIPOC and other marginalized communities. The results from my investigation were compelling. Numerous studies indicated that increased exposure to natural environments can lead to significant reductions in healthcare spending. For example, increasing tree canopy coverage to about 30% in residential areas could save 12.6 million US dollars per 100,000 people annually. Another study demonstrated that nature-based activities could prevent 12,700 cases of non-communicable diseases each year, saving $3.1 billion over the long term. In European cities, a 10% increase in green space is associated with annual mental health service savings of over $232,000. Moreover, green spaces also have intergenerational economic benefits. Children from low socioeconomic groups who were exposed to higher green cover earn an average of nearly $28,400 more over 30 years compared to those with less access to green spaces in childhood, displaying higher social mobility. However, despite the benefits of nature exposure, access to natural spaces remains a significant issue, particularly for BIPOC and other marginalized groups. Interviews with experts revealed that many communities face a lack of accessible and safe green spaces. This is compounded by insufficient infrastructure, such as sidewalks and bike paths, which increases the risk of accidents and discourages outdoor engagement and learning, especially amongst youth. Additionally, historical policies rooted in colonialism and discriminatory urban planning practices have resulted in lasting disparities in land ownership, making it harder for marginalized communities to access public lands and green spaces. These groups have also been excluded from decision-making processes, leading to a lack of representation in policymaking and a failure in addressing their specific needs. The policy experts I interviewed recommended three key interventions to address these barriers. First of these is promoting nature-based education. This can be done by introducing outdoor learning programs or locating schools near green spaces. By incorporating nature-based curricula, we can foster a connection with the environment and improve physical and mental well-being through active engagement with nature. These outdoor learning experiences enhance engagement and support academic performance and knowledge retention. Second is investing in safe green infrastructure, like urban parks, managed trails, or community gardens. Green infrastructure within urban settings is a key strategy for enhancing access to nature, as they can offer residents safe and accessible locations for physical activity and community gathering, which not only promotes a healthy lifestyle, but also promotes social bonding. Third is fostering collaborative governance by engaging underserved groups in decision making and creating diverse representation in public agencies. Collaborative governance emphasizes the engagement and involvement of diverse stakeholder groups to ensure their specific needs are met. Additionally, promoting representative bureaucracy, which aims to enhance the diversity of public servants to reflect the communities they serve, can also play a role in creating equitable access to natural and environmental resources. These findings underscore the importance of taking action, as quantifying cost savings from nature exposure can support the creation of equitable, evidence based policies for improving nature access and exposure. However, current research does not reflect our modern world accurately. Right now, most studies focus on wealthy Western nations. If you look at Figure 1, you'll see that 28 out of the 30 studies examining the economic savings of nature exposure were based on Western populations. Future research needs to focus more on underserved populations and other nations as well, in order to ensure that we are addressing both global and local disparities. Furthermore, to translate these findings into meaningful outcomes, we should train policymakers on the health and economic benefits of nature. This will ensure that green spaces and access to nature are thoughtfully integrated into urban development and public policy. Lastly, forming collaborative action coalitions where public health, environmental, and community organizations come together can be key in promoting equitable access to nature. Understanding the importance of nature exposure and promoting equitable access to nature is more than just a practical solution. It is a pathway to fostering healthier individuals, resilient communities, and a society that values both people and the environment. I would like to thank my site supervisor, Alicia Keefe, my faculty advisor, Dr. Michelle Johnson Jennings, my co-intern, Hope Flanagan, and the Earth Lab team for their support. I'm also very grateful to my family, friends, and my dogs for their love and companionship. Thank you so much.